Hello, I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 17th August 2020, for an update on the situation regarding the novel coronavirus, COVID-19, here on Nevis. I want to take this opportunity to welcome all of our viewers and our media houses who have joined us virtually. All questions will be taken at the end after each presenter would have presented. The Nevis COVID-19 briefing will be aired on Mondays at 8:30 p.m. on Nevis Television. You also have the opportunity to watch the briefing on YouTube and Facebook pages of Nevis Television, Nevis HPU, NDMD, and on Von Radio on Tuesdays at 1 p.m. With us today, we have Superintendent Lyndon David of the Royal St. Kitts and Nevis Police Force, Nevis Division, Mr. Brian Dyer, EOC Director, and Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force. I want to say welcome to everyone. And now I'd like to welcome Superintendent David to provide his updates.
Good evening all. Thank you, Nadine. And as usual, I will start my presentation by giving you some statistical information based on our operation throughout this period. Thus far, we have conducted 1,448 patrols, both foot and mobile. We have conducted 133 vehicle checkpoints, 55 arrests were made, and we have 10 persons charged, and these dealing with the COVID breaches. We had 20 crimes committed during the curfew period, and 14 persons were arrested. We have conducted 7,549 vehicle stops, and we have informed 26 persons that they will be charged or summoned for varying offenses under the COVID-19 regulations. Just a reminder of persons that these regulations will expire on the 29th of this month at 4:59 a.m. I want to encourage our business owners and operators to ensure that our customers and staff maintain physical distancing of at least 6 feet in or outside of their business establishment. And if a line to enter the business, so therefore once persons are waiting outside, all the businesses are to ensure that persons are lined up with the 6 feet distance to ensure that we are protecting ourselves from being infected with COVID-19. All are reminded that our curfew commences at 2 a.m. and will end at 4:59. So therefore, business establishments, you are reminded to ensure that you close, especially those people who may have entertainment. Ensure that you close by 1 o'clock, and all persons should leave your premises and be at home before the curfew time. Persons who meet on the road, they risk being prosecuted. So we're encouraging our persons to be at home on time. For the regulation, public place, I want to remind our person what a public place means. And it says here it includes an indoor or outdoor area, whether privately or publicly owned, to which the public has access by right or by invitation, expressed or implied, whether by payment of money or not. And I will list just some of the areas that we consider a public place. So we look at shopping centers, supermarkets, pharmacies, banks, and utility departments, bars, drinking places and restaurants, hotels, schools, or other educational institutions. And we have also public transport, community centers, and government offices. Wearing of mask. Just to expound a little bit more on wearing of mask, everyone knows that the regulation may reference to persons will be issued a ticket for failing to wear the mask. Now, I just want to say that when it comes to wearing a mask, this is what I want persons to understand. A person shall not be required to wear a mask based on the following. We know we have had concerns about wearing masks, but these are some exemptions for wearing masks. If the person is under the age of 3 years old, do not have to wear a mask. If the person suffer with a disability, cognitive impairment, dementia, asthma, chronic obstructive lung disease, or other similar health conditions. If that person is within a private space, say like in your vehicle, so we want persons to adhere to these. Now, I still will say to you, though that the regulation provide for persons to be issued with a fixed penalty, you still can be summoned. You still can be arrested for breaching the regulation if you're not wearing a mask. Offenses under the regulations carries a penalty of $5,000, not exceeding $5,000, or 6 months imprisonment, or even both. Persons who have business establishment, if you breach and you are selling, the goods can be forfeited in respect to what the money was obtained from. I am also reminding persons also that once a fixed penalty notice was lawfully issued, that person is charged with the commission of an offense, and a complaint will be made against that person and requiring him or her to either pay the fixed penalty of the $500 within 10 business days, or to appear at the magistrate court as specified in the same notice. So the date and time will be specified there. So we are saying to you, pay the money within 10 business days if you were issued with a notice, to avoid going to court. And if you go to court, well, you will have the penalty to pay. I must also remind persons that anyone under the age of 18 years and over the age of 3, if not wearing a mask, the parent or guardian will be held accountable. I will repeat, anyone under the age of 18 years but above 3 years and not wearing a mask, the parent or guardian will be held accountable. Also, we want you to understand that this person can be taken to the nearest police station and remain there until that parent or guardian do arrive. So you will be summoned to come to the station to collect that juvenile. This one will remain constant for some time. All musical entertainment by bands, DJs, and hi-fis are not permitted at this time. We know that for special activities, persons will have to apply to the Chief of Police, who will then have that consultation with the COVID task force, and then permission may or may not be granted. So we're asking persons to make written applications, do not go and organize activities, and then at the end of the day, you may spend certain sums of money, and then you cannot have your function come off. Do what is required of you. Finally, I take this opportunity to thank God for his continued loving kindness and tender mercy in our federation, wherein we are having things under reasonable control. We have seen no deaths. The governments, both federal and local, for their contribution throughout this entire state of emergency and curfew period. My staff over here at the Division C, who continue to give support and going out and enforce the COVID-19 regulations and the other laws of the Federation. The medical staff over here, the disaster staff, who are there constantly ensuring that we're getting done what we are to do concerning COVID. The essential workers who are out there daily, who are assisting. You, the good citizens who continue to cooperate and inform us when persons are breaking, and we are saying to you, continue to do that and do not participate in breaching these regulations. Thank the violators. Some of you have changed, and we want to thank you for that. But those who are continue to breach, we are saying to you, help us to protect our federation from COVID. We have seen the effects around the world. And I also take this opportunity to thank our media personnel who are there to help us to reach a wider cross-section of the community and by extension to other parts of the world. Thank you and enjoy the rest of the evening.
Thank you, Superintendent David, for your update. I'd now like to welcome Mr. Brian Dyer, who will provide his update.
Good evening, all. We start with some weather, tropical weather outlook from the National Hurricane Center. Last week we saw the passage of tropical storm Josephine, and we had Kyle in North Atlantic. For the remaining of this week, we have two systems in the tropical Atlantic, tropical waves that is, that however are showing some signs of development. Tropical wave number 1, a tropical wave approaching the Windward Islands is producing a large area of disorganized showers and thunderstorm activity. This disturbance is moving westward at about 20 miles per hour and is expected to continue to move quickly westwards over the eastern and central Caribbean Sea during the next couple of days. While it is likely for limited significant development, after that time, however, the system is expected to move more slowly westward across the western Caribbean, where upper-level winds could become more conducive for the development this week. A tropical depression could form during the latter part of this week. Regardless of development, locally heavy rainfall and gusty winds are expected over portions of the Windward Islands through Tuesday morning. Formation chance of this system for 48 hours, low, 20%. However, formation chance through the next 5 days, medium at 50%. We now move on to the tropical wave number 2, which is in the far east. The current projections for this system shows that the northern Leeward Islands could be impacted on the weekend, so we have to pay close attention. The information on this system, a tropical wave over the eastern tropical Atlantic is forecast to interact with another disturbance located several hundred miles southwest of the Cape Verde Islands within the next day or two. This interaction is expected to lead to the formation of a broad area of low pressure, and conditions are forecast to be conducive for development of a tropical depression during the middle to latter part of this week, while the system moves westwards to west-northwestwards at 15 to 20 miles an hour across the central and western portions of the tropical Atlantic. Formation chance to 2 days or 48 hours, low at 30%. Formation chance through 5 days, high at 70%. Again, based on the current forecast tracks that have been analyzed, it could pass through the Leeward Islands or just north of the Leeward Islands, like Josephine. So it needs to be monitored by all. And if it comes close to the Leeward Islands, then the necessary watches and warnings would go into effect from around Thursday, based on the development of this system. So again, I appeal to all to continue to monitor the progress of this tropical system as we approach the peak of the Atlantic hurricane season. Finally, a note to the promoters and entertainers, persons who usually arrange or promote activities. The COVID-19 task force is looking forward to entertaining some discussions with this group of persons on Thursday at 2 p.m. So persons who consider themselves promoters or entertainers, you are asked to come to the EOC on Long Point Road for the 2 p.m. meeting, where we will have discussions with the COVID-19 task force, both the Nevis task force and the federal task force, along with your counterparts on the island of St. Kitts. The aim of this meeting is to develop guidelines for the next SRNO when we continue to give back some of the civil liberties that were restricted as a result of the impact of COVID-19. So again, please to be aware that there's a meeting at 2 p.m. on Thursday for all entertainers and promoters. Thank you very much.
Thank you, Mr. Brian Dyer. I'd now like to welcome Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force.
Thank you, Mrs. Catty-Keynes, and good evening to everyone. I'll start, as I usually do, with the global figures. So globally, there have been 21,549,706 cases of COVID-19 to date, with 250,285 new cases over the last 24 hours. Over 767 persons have died, with over 5,000 deaths occurring in the last 24 hours. The United States of America, Brazil, and India continue to lead in the number of cases of COVID-19. On Nevis, we have tested so far 274 persons. 267 have tested negative, while 4 have tested positive, and we have currently 3 tests pending. We have no one in isolation. There are 24 persons currently in quarantine, and since March, we have released 318 persons from quarantine. We continue to receive repatriated citizens and residents, and to date, 122 persons have been repatriated over the last 109 days, of which 98 of the repatriated have been tested and released. Now, we have been sharing for some time now the tools available to us to break the transmission of COVID-19, such as hand washing with soap and water frequently, the wearing of masks, and you heard from the superintendent just a while ago about the wearing of masks, social and physical distancing, staying at home if you're sick, and calling your healthcare provider for advice on your care before going to a health facility. We have no vaccine for COVID-19. These are therefore the public health tools that are available to us, and that's all that we have right now. We also know that another proven way to break transmission of COVID-19 is to detect cases early, readily isolate persons who are positive, readily identify persons who have been in contact with the positive case, and quarantine and test these contacts. Now, this is what we did during the first wave, and as you are aware, it worked. We were able to break transmission of the disease and avoid community spread. I want to speak a bit about that today, about contact tracing. Now, contact tracing slows or stops the spread of COVID-19 and helps to protect communities. So what is contact tracing then? This is the process of identifying, assessing, and managing persons who have been exposed to a disease to prevent onward transmission to other persons. For COVID-19, we identify persons who have been exposed to COVID-19 and follow them for 14 days. So how is this done? If you are diagnosed with COVID-19, you will be called by a public health officer, which will be a nurse, an environmental health officer, or a doctor, to check on your health first and foremost. But they will also ask you who you have been in contact with at home, at work, at play, and where you would have spent your time 2 days before your symptoms would have started and up until you are diagnosed and isolated. Now, these persons that you would have been in contact with are who we call your contacts. Any information that you share is kept confidential. So who is considered a contact? A contact is defined as anyone who has been within 1 meter of a COVID-19 case for more than 15 minutes. Anyone who has had direct contact with a COVID-19 case. Anyone who has been providing direct care for patients with COVID-19 without using the proper personal protective equipment. So, for example, a nurse or a doctor taking care of a patient in hospital but not using the proper personal protective equipment. Anyone living in a household with a positive case is considered a contact. And anyone who has been sitting within 2 rows of a patient on an aircraft or in a vehicle for more than 15 minutes. And there are other definitions of contacts, and there will be in-depth interview of persons, and therefore the healthcare provider will be able to determine if you are a contact of that person or not. Once the name of the contacts have been shared, then a public health officer will call the contacts, explaining to them that they may have been exposed, and will interview each one. Contacts are quarantined for 14 days and are monitored daily. They are asked to monitor themselves also for symptoms, any symptoms that may develop, including fever, chills, sore throat, cough, runny nose, nasal congestion, shortness of breath or difficulty breathing, muscle pain, loss of taste or smell, or diarrhea, and to report these promptly. Contacts in quarantine are asked to take their temperature twice daily if possible, that is, if they have the means to do so, and to report these temperatures. Once contacts in quarantine feel unwell during that 14-day quarantine period, they are asked to call the helpline or another identified number, and the proper referral is done. Testing is done if the contacts develop any symptoms during the quarantine period. So if a person develops any of these symptoms during the quarantine period, they are tested for COVID-19. If there are no symptoms during the 14-day quarantine period, testing for COVID-19 is done on day 14 of quarantine. Since persons may have the disease, they may be in quarantine, they may have the disease but not show any symptoms, so we still test at the end of the 14 days. So that's just a brief about contact tracing. Contact tracing then is critical in breaking the chain of transmission. And if you are approached and told you may have been in contact with a COVID-19 patient, please cooperate so that in the event you do have COVID-19, you would not pass it on to others, and thus you'd prevent an outbreak. Thank you very much.
Thank you, Dr. Judy Nesbitt. And I'd like to open up for questions from our media houses. Jarvis Brown of One Radio asks, can we have an update on the quarantine site breached here on Nevis?
Yes, thank you very much for that question. I'm happy to say that we conducted our investigations, and thus far I know that one of the persons was contacted and informed that he will be summoned for the offense, and the other person will be soon. Therefore, we'll have our case files get ready to go before the court. So at the end of the day, we will be taking these matters before the court, and soon as we get that opportunity to do. So at this time, I take this opportunity to encourage persons to continue to follow the instructions given and stay away from the instruction sites so that we wouldn't have any more of these things taking place. Thank you very much for that question.
Thank you, Superintendent David. Jarvis Brown from Bond Radio. Since the SRNO number 35 have come into force, has the police here on Nevis charged or arrested anyone in relation to the $500 fixed penalty notice?
Thank you very much for that question. Again, I will make a little correction based on the question. It's Regulation 38 of 2020 and Emergency Powers COVID-19 number 13. In terms of the fixed penalty, we are currently awaiting the booklet to be printed. Once that is done, we will be issuing tickets. However, as I mentioned earlier in my presentation, it does not negate the fact that persons can still be informed that they will be summoned or arrested. So we are encouraging persons to do not be arrested, do not be summoned, or even issue a notice because you don't want to wear the face mask. From time to time, we, the police officers, when we see people, we are encouraging them to wear masks. The time will come when we will just tell you, look here, you're under arrest and we're going to summon you. So we are just encouraging persons. Comply. Right now we want to ensure that we giving that good period of education, because once we start to do this, we would not really want much explanation. Send that to the court and see if the magistrate will be lenient on you. So people, let us be serious and comply with the wearing of the face mask. As it says, I guess Doc would have said it before, but remember, the mask protects me from you and you from me. So let us continue to protect our federation. Thank you very much.
Thank you, Superintendent David. We have a question from Daniel Moore, Von Radio. Given the government just announced that 2 cruise ships will be allowed to dock at Port Zante on Wednesday, August 19th, would the guests and crew be subjected to any mandatory quarantine or testing upon arrival? Dr. Judy Nisbet will answer this question.
Thank you for that question. Yes, we are aware, of course, that the cruise ships, the 2 cruise ships, will be docking at Port Zante. Prior to persons coming off of those cruise ships, they will be subjected to quarantine, just as we have quarantined persons who are coming into the Federation at this time. So there will be mandatory quarantine of all persons on those cruise ships. Once they have been tested and they test negative, then they will be allowed to leave. However, if anyone tests positive, then again, that's an extended quarantine for those persons who are on the ship. So until there's an all clear that all persons are negative, persons will not be allowed to disembark. Thank you.
Thank you, Dr. Judy Nisbet. Okay, that will be all questions for today. I'd like to say thank you to all our media houses and to all our presenters. And I want to remind persons of some of the measures that can be taken to reduce your risk of contracting or being exposed to COVID-19. Wash your hands with soap and water, cover your cough and sneeze appropriately, and wash your hands immediately. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch surfaces often. Eat your fruits and vegetables to keep your body strong. Drink plenty of water and exercise often. Practice physical distancing / social distancing. Use your face mask or covering when in public. Of course, that comes with a penalty if you don't. Stay at home, especially when you are feeling sick. Hotline number 311, or you can call 661-5051. I want to say thank you to the Nevis Disaster Management, Nevis Television, Caribbean Digital Display Limited, Cornerstone, staff of the Health Promotion Unit, and the Nevis Task Force members for making this briefing possible. I am Nadine Carty-Keynes, and please join us on Monday at 8:30 p.m. for another Nevis COVID-19 EOC briefing here on Nevis Television. Thank you for viewing, and please do stay safe.